there, my name is Hafsa Banade, and the disease that I'll be talking to you guys about today is Addison's disease. Addison's disease is a very rare condition. Only 1 in 100,000 people have it. It can happen at any age to either men or women. And Addison's disease is a disorder in which the adrenal glands don't produce enough of the hormone called cortisol. Cortisol's main function is to help body respond to stress. It also helps regulate your body's use of proteins, carbohydrates, and fats, and helps maintain blood pressure and cardiovascular functions. When the body's immune system mistakenly attacks the adrenal glands, it's called autoimmune disease, which accounts for about 70% of Addison's disease. Infection, cancer, HIV, and tuberculosis can harm the adrenal glands. Addison's disease is due to secondary adrenal insufficiency, which is caused by a problem with the pituitary gland or problem with the hypothalamus. A pituitary hormone called ACTH is the switch that turns on the cortisol production in the adrenal glands. If the ACTH levels are too low, the adrenal glands stay in the off position. Organs that are affected by Addison's disease are the hypothalamus, the pituitary, and the adrenal glands. The hypothalamus coordinates both the autoimmune system and the activity of the pituitary, controlling body temperature, thirst, hunger, and other homeostasis systems. The pituitary gland is a pea-sized body attached to the base of the brain, which is important in controlling growth, development, and functioning of other endocrine glands. It makes several important hormones like growth hormone, pituitary hormone, thyroid stimulating hormone. Some tissues that are affected are the neural crus ectoderm, the intermediate mesoderm, which are tissues in the adrenal gland. Cells that are affected are the mesoderm, somatotrophs, and the neurosecretory. Signs and symptoms of Addison's disease are weight loss, headache, dizziness, vomiting, hyperpigmentation, abdominal pain, constipation or diarrhea, muscle cramp, and so on. Symptoms typically develop slowly, but there can be sudden deterioration that may be triggered by infection, injury, or the need for surgery. Untreated Addison's patients are unable to respond adequately, resulting in Addisonian crisis that can be life-threatening and requires urgent treatment. There's also risk of developing other autoimmune disease. Treatments for Addison's disease involve in hormone replacement therapy to correct levels of steroid hormones your body isn't producing. The treatment for Addison's disease will depend on what is causing the condition. Medication for Addison's disease could be a combination of the glycocorticoids medication, which are drugs that stop inflammation to improve your health. They will be taken for the rest of your life, and one dose cannot be missed. Also, hormone replacement therapy may be prescribed to replace hormones that your adrenal glands are not making. Keeping your stress level down is an important part to help your medication work. When properly monitored and controlled, there should be no side effects to treatment. There's always some consequences to medications being taken, but there is no long-term consequences in Addison's disease as long as the medications are taken daily, the doctor's orders are followed, and treatment is regularly monitored. Although Addison's disease is a lifelong condition, it can be successfully treated with daily medication, and patients can lead full and active lives. And then here are all the sources that I used. Thank you.